so much. On Friday, the city of New Orleans announced the first human case of West Nile virus was detected in Orleans Parish. The CDC reports 2 more cases in St. Tammany. It spread to humans through the bite of an infected mosquito. Now, according to the Louisiana Department of Health, virus activity has been confirmed in at least 14 parishes so far this year. Last year, there were 57 confirmed human cases in the state, resulting in 3 deaths. Joining us now to talk about ways to protect your family is our chief medical correspondent, Dr. Corey Hebert. Good morning, Dr. Hebert.
Good morning. How are you?
I'm doing well. How are you?
Well, not so well, because I got about 20 mosquito bites yesterday, and I'm not happy about it.
Oh, no. Well, that was my first question for you. How worried should folks really be when they hear that these West Nile cases have been found in humans?
Well, the first thing I want to let everybody know is that you don't need to really be too worried, because less than 1% of people that even get infected get severe symptoms, all right? So even if you were to contract this, the odds of you getting very sick are very low. But the issue is, this is like the lottery, meaning that, it doesn't matter how rare the winner is, somebody's going to win. And if that person is you, it's 100%, no matter how rare, right? So the key is to prevention and just being out, in all different types of places. This can just cause you to have very severe disease. There's 2 types of the severity that you can get from this type of thing. And it can be the regular, just fever, and then it can get into some very serious neuroinvasive disease. So you get fever, you get chills. The fever is usually about 102, but then you can get body aches, rash, abdominal pain. All these things are just the very mild cases. But you can also get severe lymph nodes swelling, and then neck stiffness, confusion, tremors, all this type of stuff. And so you just gotta, like you said, you just gotta be careful, because you have to be mindful that you can get this anytime. So you have to prevent. And how do you prevent? You gotta wear, this mosquito repellent, and you gotta stay out of the areas where these mosquitoes are just such in high numbers right now.
Absolutely. And one thing I want to point out to folks, you see the different kinds of mosquito repellent at the store. Some have DEET, some don't. I mean, any expert advice you would give us on what kind they should be using?
Yeah, I mean, if you're going to be going out in the wilderness, hunting and this type of thing, I mean, you might need to wear some of the more heavy duty mosquito repellents. But, especially for, people that are going deep into the brush. But if you are just going to be sitting by the pool or going to play tennis or golf or something like that, there are some natural alternatives. Do they work as well? That's up for debate. Some people say they do, some people say they don't. And we're talking about like Consumer Reports. We're not talking about our friends. Always remember, it's not a friend thing when you get health advice, please. And stay off the internet unless it's something that is like a WebMD or our website. Don't go to these blogs that are not standardized. But I do want you to know that there are natural alternatives, and if you're going to use them, you need to reapply. That's the biggest thing. Just like with sunscreen, you've got to reapply. And the ones that have the DEET in there, are they safe? Theoretically, they are, but that is a poison as well. So you want to make sure that you don't over apply that, but you do want to make sure you follow the directions, because you have to make the a part of the body that are exposed, the parts of the body that are exposed have to be treated appropriately.
All right, great advice. Thank you so much, Dr. Hebert, for joining us this morning. We appreciate it.